It's always a pleasure to hear what Mark is going to say about me at the outset, so I wait in the entire year to hear what he's going to say. Thank you for not failing me. So I'm actually going to use a PowerPoint. I didn't negotiate with Roy at all. He had no idea I was doing this. I've done this before, and I know if I don't use a PowerPoint, you'll look at my face for 15 minutes, so I figured this was a good alternative. There's little doubt that mental health issues are prevalent in Canada and indeed across North America and throughout the world. There are all sorts of competing statistics about how big the problem is, but a number that's commonly used is 1 in 5. And it drops even to 1 in 3 when we include addictions as part of the overall problem. But there's a distinction that I want to make at the outset that's very important, and it's very important for you to make when you're dealing with these kinds of problems in your workplaces. And that is the difference between a mental health issue and a mental illness. Now, for those of us in Toronto, the distinction between mental health and mental illness should be clear. When the Toronto Maple Leafs blew a 4-1 lead to the Bruins, I, like many of you, was devastated, thunderstruck, and gobsmacked, but I was not clinically depressed. When I threw a pillow at my TV set, I was angry, but I was not psychotic. When I truly believed for about 8 or 9 minutes that the Leafs would win, I was foolishly optimistic. I was not delusional. When I woke up the next morning with a hangover, I had had far too much to drink the night before, but I was not an addict who had a substance abuse problem. Now, that distinction between mental health problems, which are periodic, episodic, usually short-term in nature, and which over the course of a lifetime may afflict any of us or any of our family members, and mental illness, which is a diagnosable condition, is regrettably something that not enough doctors seem to understand, and it's something that not enough human resources professionals push back on at the early stages of an issue. As the slide says, mental health is a human resources issue, but mental illness is a legal issue. Now, the effects of mental health, that is the human resources issue in the workplace, can certainly be far-reaching, and you would know these: absenteeism, turnover, the rest of it on the slide. And you certainly have to be concerned about the environmental factors in your workplace, which may create stressors that lead to mental health problems amongst employees who are otherwise mentally healthy. The particular legal responsibilities arise for an employer when the employee's mental health issue arises from a condition that is clinically diagnosable as a mental illness or disability under the applicable human rights legislation. And as we know, in Ontario, we have the Human Rights Code. We have Section 5, which protects employees against discrimination and harassment on the basis of disability, which is a defined term in the code, and it includes a condition of mental impairment or developmental disability and a mental disorder. The framers of the code, frankly, seem to be a little bit loosey-goosey in terms of their terminology, but taken together, that is therefore a clinically diagnosable medical condition. So the legislation and the state of the relevant case law protects employees against discrimination and harassment, but only if they have a diagnosable disorder. And that's sometimes, frequently, often, almost always, very difficult to sort out, at least at the outset. Now, you have a duty as an employer to inquire into whether or not an employee's behavior or poor performance of the workplace is actually caused by some kind of mental disorder. And so the case law is fairly clear that if there's a manifestation of abnormal behavior or conduct in the workplace, you have a duty to inquire into that to determine what the underlying cause may be. Now, most of the time, the underlying cause is probably disciplinable misconduct, and you simply respond to that with a corrective action plan. But in some cases, and many of you will know this, for example, when you're dealing with drug addicts or alcoholics, the poor behavior, poor attendance, or whatever the problem is that you're dealing with, when you explore it, reveals a condition that actually is a disability that has to be considered in accordance with the accommodation and hardship principles that you're familiar with under human rights law. So when you're made aware because the employer or the employee's doctor identifies a medical condition, or when you ought to be aware because a problem, once you inquire into it, suggests that there's some kind of disability that may underline the problem, you have to inquire into that. And there are steps outlined on the slide which get you started in terms of what that inquiry entails. Ultimately, that inquiry is going to take you to the employee's doctor, and I'll get to a couple of slides on that in just a moment. But I want to give you some good news. This is not just a one-way street. The employee has a duty to inform you as well, and you'll see the employee also has a duty to cooperate. So the employee has a general obligation to inform the employer of a disabling condition, and the employee also has to provide some information, fairly basic at the outset of the issue, but more involved as the issue goes on, either because there's ongoing manifestation of poor behavior in the workplace or because there's ongoing absenteeism. Now, just because the employee informs you, it doesn't necessarily mean that there's a duty to accommodate arising. You may not have to do anything because the nature of the disability may not require accommodation. And also, as you well know, when you think about physical disabilities, an employee is not able to self-diagnose. So an employee who tells you that he or she is stressed out or suffering from some kind of mental disorder is not telling you anything of great consequence unless and until it's backed up by medical opinion. So what information is required? Well, here's one of those great legal terms, sufficient medical information. It's always very helpful to have a lawyer tell you those kinds of things. But the sufficiency of the information may evolve over the lifetime of a problem. So at the outset, much like with a physical disorder, the nature of the information you're entitled to is what is it about the employee's condition that makes the employee unable to work at his or her regular job, that makes it necessary for the employee to have accommodations made in the workplace, or makes it necessary for the employee to be absent from the workplace. Now, just a little side note here, I should tell you that an alarming number of doctors seem to think that the proper cure or treatment for a mental disorder is to remove the employee from the workplace for prolonged periods of time. I believe, and I haven't gone to medical school yet to establish my credentials for saying this, but I'll say it in any event, I believe that that's entirely the wrong approach, and that most informed psychiatrists would tell you that removing an employee from the workplace for any more than a couple of weeks in the context of a mental disorder is exactly the opposite treatment to what the employee requires. So be aware of doctors who quack like Don's duck and tell you that that kind of treatment, that is prolonged absence from the workplace, is necessary. I think that's bad medical advice. The paper, because I'll skip along, I'm probably getting close to the end of my allotted time, Mark? So I'll skip to the end. Well, Don told a 10-minute joke. I mean, it's not my fault. The paper you'll find, which I owe a great debt to my colleagues who are noted at the outset, Casey Dockendorf and Pamela Hinman. The paper has a part 2 which deals with the interaction between an employer and doctors, and also gets into the accommodation to the point of undue hardship issue, which you're familiar with in the context of physical disabilities, and from a framework standpoint is very similar in the context of mental disabilities. So I'll commend to your attention part 2, starting at page 16, and leave you to read that. I did want to and Roy will say this is why you only have 2 PowerPoint slides, because you can't get to the end of it. I did want to ignore the rest of my PowerPoint and bring to your attention a couple of recent developments so that I can leave you with this, and then I will turn it over to Chris for his 3-minute speaking time. and that is that many of you will be familiar with the Diagnostic and Statistical Manual of Mental Disorders, what is commonly referred to as the DSM. And you will probably be familiar with the DSM-4-TR, which is what has characteristically been used as the medical tool to assess and diagnose mental disorders in North America. This tool, by the way, dates back to 1840. In 1840, the only 2 categories were idiocy and insanity. Apparently, I don't think I've ever been insane, but I've frequently been accused of being an idiot, so I guess I was mentally disabled back in 1840. But as of May of this year, we now have the DSM-5, which is the new manual. And the DSM-5, I should tell you, because it's very important, going back to my original point about making this distinction between mental health disorders and mental illness, the DSM-5 has come under considerable criticism already, including from one of the architects of the DSM-4. And part of that problem, and this is the last thing I'll tell you, but it's just to sound a warning note, sound an alarm, stems from the increasing diagnosis of mental disorders in North America. Now, listen to this, it's absolutely astounding. In 1980, 2 to 4% of Americans were diagnosed as suffering from an anxiety disorder. In 2009, that number has risen to 49.5%. There has been a 1,200 times increase in the diagnosis of anxiety as a mental disorder. And as I say, the DSM-5 has been criticized, and the concern is that because the threshold for disorders, anxiety disorders in particular, has been set so ridiculously low, not my words, these are the words of psychiatrists who are concerned about it, DSM-5 will mislabel as mentally ill many people who are experiencing no more than the normal and expected worries of everyday life, like, and this is now me talking, getting a disciplinary notation and going home because you're situationally depressed or chronically stressed. In any event, those are the concerns you and I and the rest of my partners get to deal with over the next 10 to 20 years, because this will be a hot issue for many years to come. Thank you very much.